So this is a epidermal inclusion cyst, sometimes erroneously known as a sebaceous cyst, but it's not a sebaceous cyst because that would imply that it comes from the sebaceous glands, whereas epidermal inclusion cysts actually arise from the hair follicle. There's often some damage or blockage to a hair follicle, maybe a blackhead develops, and then there's nowhere for the skin cells to migrate out of, so then all the keratin and debris builds up into this collection that then becomes almost like a ball. You can see the components of the cyst. This is excised from the top, which is the epidermis, and underneath the epidermis, this is dermis. And then you actually have this whitish lining, by definition, cysts are an enclosed structure that is surrounded by an epithelial lining. And then inside the cyst, you have a whole bunch of keratin debris, which this one is a little bit punctured, so you can actually squish some of the material out of it. Occasionally, sometimes cysts can actually rupture spontaneously, or if there's trauma, and then the lining kind of ruptures and spills out this keratin debris into the body. And then to the body, this old keratin is very, very irritating, almost like a foreign body. So then it causes a very painful inflammatory reaction, which often feels like an infection. So oftentimes in these cases, someone will go to the urgent care or the emergency room or see their doctor for what they think is an infected cyst. But cysts are almost never infected truly, but it's more that there's just an exuberant inflammatory reaction because of all this dead material that's been building up for probably years. Then gets released into the surrounding structures. But bye-bye, cyst.